Well, here we are. Let's keep up and let's catch up from where we left last time. We're starting to talk about connective tissue when we stopped just before the exam. So here's the overview. I take some of these slides straight from your study session on the Pearson extra study resources that they have. So some of these slides, when I like them, I just pop them in our PowerPoint. So here, we have talked about before, right? We have talked about here the epithelial tissue, that is done. So now we are here talking about connective tissue. Then later on, we are going to talk about muscle and also nervous tissue. So here we are going to focus in this part, in this type of tissue that we have. Again, keep in mind that we have 4 types of tissues in the body, right? Connective tissue tends to be a bit confusing sometimes because it's important for so many things and it's like all over the body. Sometimes we kind of get confused on like what is it doing, and how to distinguish it from other tissues, right? So I'm trying really to get this organization in a certain form that is going to be more like intuitive way of looking at it. Okay. So basically here, I like the way that the book puts it, dividing connective tissue under 2 subcategories. So one big category is called proper. Okay. So this is what is like the proper connective tissue. Okay. And then the other category is more like specialized. So the easy one to understand is this specialized tissue. So there are two basic types of specialized tissue. One of them is cartilage and the other one is bone. So those are specialized in support. Okay, that's going to look later. So when you look at proper connective tissue, so this is like all the rest of connective tissue that is put into one bucket. Okay, so you're going to have like loose connective tissue, dense connective tissue, and then you're going to have tissues that are important for elasticity and for transmitting force and for support and for binding. So all this mass gets put into one bucket of proper connective tissue. So let's take a look at that. So again, looking at overall picture of what the connective tissues are. So we have a lot of types of tissues. So this is straight from that worksheet that is in your Pearson extra study guide. Okay, I try to push this down and it tries to go up. Okay, forget it. So here. So what do you have here? When you look at proper connective tissue, right, we can see that you're gonna have here all different types. Here it's showing you something that is very much parallel. You see these parallel fibers here, okay? So you see that this is a kind of tissue that you should be able to look at it and identify, is it messy or is it organized, all right? And then you see that this here is most likely some kind of tendon or ligament, okay? But you're gonna see how to recognize what kind of tissue that is. So you have this proper connective tissue, and then you have this cartilage and bone, right? So we're going to see what are specific characteristics of cartilage as well as bone. And then you have this other liquid type of connective tissue that is blood. So that's the only liquid type of connective tissue, as well as lymph, right? So lymph comes from the blood anyway, right? So we know that all connective tissue, or most of it, basically comes from the mesenchyme, as I mentioned before, right? And when you look at the arrangement of cells, you have more stuff than cells. And of course, we don't call it stuff, we call that extracellular matrix, right? So we have matrix and fiber and cells here and there. Keep in mind, you always have exceptions to those rules, right? So I like this picture here that they have on that worksheet. That is saying, how can you identify this type of a connective tissue? So here you see that if you look at at an ice cream. So the cream itself is the stuff, right? And then you look at toppings, in this case, like, I don't know, little white chocolate and dark chocolate, like sparse all over the top of that ice cream. So those would be your cells, right? So we're kind of missing the fibers here. So, I don't know, just imagine that somebody with long hair just put out a bunch of hair and put it in the ice cream. Those are the fibers. And yuck. And that's actually a good strategy for you to memorize things. You start putting ridiculous things together, and then you can't forget it. And kind of going in your head is like, oh, hair and ice cream. So next time you go eat ice cream, just think about connective tissue. Put some toppings, don't put the hair. I mean, you want to eat the ice cream, so just think about the matrix, the actual ice cream, and you know, the fiber and the cells. So this is the kind of arrangements that you have. Okay. So what is in the matrix, and what is it, the purpose? What is the purpose for that stuff, right? So in the matrix, you're gonna have this this stuff, right? The gelatinous stuff, and you're gonna have also the fibers that are gonna go in this extracellular matrix stuff. A lot of times you have collagen fibers, and those are very important to give strength to the tissues, right? And most of the time you're going to have these fibers, these things that are not made up of collagen. So you call them non-collagenous stuff. And a lot of times you have these glycoproteins. Now, what does it mean? Glyco is from sugar. So glucose, glycoproteins. And of course, proteins is for whatever is made up of amino acids, right? So you have sugars and proteins. And those are not fibers, they're just like mush, okay? And you also have these other things called proteoglycan aggregates. You go, okay, proteo is for proteins, glycan is for sugar. And you're like, okay, what's the difference between a proteoglycan and a glycoprotein? And you're like, to me it's about the same. Oh, it's not really. When you look at glycoproteins, these things are made up mainly of protein, mainly of glycol part of sugars, and they have some proteins attached to those sugars. And then the other ones here, they are mainly made up of protein, and they get some sugars attached to the proteins. So it depends on the abundance of the thing that you have in this composition, okay? But yeah, sugars and proteins. Okay. Now, you see that those are really, really important for example, cartilage. In this case, like in proteoglycans, you have proteins like very, very important. They're called GAGs. So those are glycosaminoglycans, and also hyaluronic acids. Those are very important for joint functioning and cushioning. Okay. All right. So you have the fibers, and then you have this ground substance in the matrix, right? So that is the gel-like or the stuff that is put between the cells. So it's filling up space. Okay. And this is important here. Okay, one thing that is important to know here is that whatever is going to go through this medium is going to be diffusing through this ground substance. Okay. Remember that we said that when you have epithelial tissue that forms the boundaries, that epithelial tissue is not vascularized. Right? Now, connective tissue, on the other hand, tends to be highly vascularized. Of course, to one exception, but keep in mind it's highly vascularized. So your epithelial tissue is going to be connected to your connective tissue. And the epithelial tissue is going to get the nutrients that are coming from the connective tissue. So epithelial doesn't have blood vessels. Connective tissue has the blood vessels. When your nutrients pass through those very, very fine capillary beds in your connective tissue, it lets it diffuses to the extracellular fluid, and that will allow these nutrients to get to your epithelial tissue, right, through diffusion that is coming from the connective tissue. Okay, so in order for you to allow that to happen, the stuff is going to diffuse through this ground substance, right? So that's the mush that things are going to go through. Okay. What makes up the ground substance? Of course, you have this interstitial fluid. That's the liquid that is coming from the blood. And let me see. You have adhesion proteins that are produced by the cells that are in the tissue. Okay. And you have those proteoglycans and polysaccharides. Let me see here. Oh yeah, one important thing about those proteoglycans and polysaccharides is that they tend to be highly negatively charged. So on the surface of this mush stuff, you have polarization. So you have charge there, and your negative charge is going to attract water molecules. So this matrix is going to be very hydrated, right? Remember what I mentioned about the easy water? The water that coordinates and has a charge distribution and all the good stuff. So the nature of this mush makes easy water, okay? And you imagine that thing is already gelatinous, and then you get the easy water in that fourth state that gives even more cushion to that substance. Okay? So here you have a picture of what hyaluronic acid looks like. Who has heard of hyaluronic acid? Yeah, hands up, yeah. Where do you find it? Huh? Yeah, I was thinking more like joints. But yeah, you can put skincare. Yeah, I was thinking more about the athletes. They're running so much, and then you get knee problem. You gotta go to the orthopedic doctor and like, let's give you a shot of hyaluronic acid. Yeah, but yeah, skincare. Yeah, I shouldn't pay attention to wrinkles. No, I'm not in my 20s anymore. But yeah, skincare as well, right? It kind of fills up spaces so your skin doesn't look as wrinkled. And actually, it helps to hydrate the skin. And now look at this. Why is it that it helps to hydrate the skin? Look at those charges. You see here? Oh, negative charge, and more negative charge, and more negative charge. And no, you don't have to know the structure of this beast, but you should look at it and you say like, oh, I see negative charges. That means it will attract water. So yeah, it makes sense if you put it on your skin is going to be very hydrated because you're going to keep water around there, right? That should make sense. Okay. So here is a picture of another type of mush that can get in cartilage structures, for example. So this is a type of proteoglycan aggregate, and you see that you have fibers that are connected to proteins. So you have linker proteins, and then you have core proteins, and then you have some sugars that are branching out of those core proteins. And you see in the type of arrangement that is very much organized. And then you imagine all these sugars that are popping out of these core structures. Those have negative charges, so this thing is highly hydrated. So here comes your first question. Well, hold your thought. I forgot you. Put on your eye clicker. Yay. Okay, one sec. Let me lower this and get the eye clicker. Oh, this mask just gives me that déjà vu feeling of COVID. Oh my goodness, it's telling me to update the device. No, I'm definitely not doing an update like right now. And then the thing is not going to work. In the meantime, you can take your time to answer your question. And when this thing goes on, you can just submit your answer like quickly. Okay, might be later. All right, so the first question is up. And the question is, what part of connective tissue takes up most of the volume? Four, three, two, 1, 0. What is your answer? A. One person answered B. I hope that it was just a slip of your thumb. Cells do not take up most of the volume in connective tissue. What is it? It's your extracellular matrix. So, what is it making up those tissues, right? So you have cells, so you have different cell types, two types that I want you to keep in mind. Those are your blasts and your cytes. So blasts, they come before the cytes. So blasts are less developed than your cytes that are more defined or differentiated. Okay? So blasts are baby cells, so B is for blast, for baby, okay? And what kind of blasts you have? You have blasts that make fibers, so those are your fibroblasts. You have blasts that will make cartilage, so those are your chondroblasts. Anything that has chondro with it, you think cartilage, right? Of course. Okay. Now, if you're going to make bone, you think osteo. So osteoblasts are the baby cells that will make a bone matrix, okay? So those are your more immature type of cells. When they mature, they become cyte cells. So you're going to have fibrocyte, you're going to chondrocytes, osteocytes. Chondrocytes and osteocytes are mainly the ones that we see more often here. So different types of cells. And you're also going to have the different types of connective tissues that they're mainly going to be packed together, so this is going to be dense or it's going to be loose. It's going to be quite easy to identify which type it is. So here are examples of cells that you're going to find, and remember most of those cells are coming from the mesenchyme, right? From embryologically similar tissues. All right, so you have all different types of cells here, and here you see cells of the blood. That your blood is also the connective tissue, right? So you have all kinds of blood cells here, like macrophages, mast cells, and lymphocytes, and plasma cells, and neutrophils. Do you remember mnemonic to know all the blood cell types? No, things like never let monkeys eat bananas. That's it. So never is for neutrophils. Let for leukocyte, eat for eosinophils, monkeys for monocytes, eat for eosinophils, bananas for basophils. But you don't really have to memorize all that because that will come later on the second, AP2 class. But if you see this type, this type of cells, you should recognize that that's a kind of a blood cell. That is type of connective tissue cell. Okay. So here, this is showing you fibroblasts, and those are very important for synthesizing the fibers that you're going to have in your connective tissue. And here is showing you this fibroblast cell that is synthesizing collagen. Okay, and fibroblasts also synthesize a more elastic fiber, that is the elastin. Okay, so collagen and reticular and elastic fibers, and whatever those fibroblasts are doing, they are making up the stuff that is filling up the space between the cells. Okay, so it's making the matrix. So these cells are very active in producing stuff or producing proteins, right, to fill up the spaces between the cells. So when you look at electron micrograph of a cell, you will see that these cells have a lot of endoplasmic reticulum and a lot of ribosomes. So a lot of rough ER, and remember that a function of the rough ER is to produce proteins that are going to be secreted, right, out of the cell. So it makes sense that these cells here have a lot of ER and is very active in producing proteins that are going to be dumped out of the cell. Okay? So here you see the nuclei of those cells, and you see stained fibers close to those cells. Okay. All right, so other types of cells that you have fat cells. Right, remember, fat tissue is connective tissue, although that's the one exception, that you have cells that are close to each other, but they are not tightly packed. They are not connected to each other, and they are kind of flexible. Is in a kind of a disorganized way, but they can inflate or deflate depending how much fat you are storing in the cells. So you have fat cells that have little matrix between the cells. Right? You have your white blood cells, so those are the ones that I have mentioned before, and they are very important for body defense, right? Immune defense, as well as for recovery of tissue injury. And let me see here. Oh, this is type of white blood cell. This is mast cell, macrophages. Yeah, type of function in the immune system. So here we see cells that are stem cells, so mesenchymal cells. Those are stem-like cells, and remember, those are the origins of most of the connective tissue cells. What you should know from here, as I mentioned, those are cells in the blood, and they're important for immune system function. But you should keep in mind here that lymphocytes are the ones that produce antibodies. Okay, so those are going to become plasma cells and produce antibodies. You have other cells like mast cells that are very good at producing histamine. And does anybody know what the histamine is good for? Yeah? Well, actually, histamine causes inflammation, but you're in the right track. Yeah. So when you have an allergic reaction, you usually take an antihistamine to quiet down the histamine. And interestingly, also histamine is an excitatory neurotransmitter. So histamine also works in your brain, and it gets you awake and excited. It's excitatory neurotransmitter. So if you take an antihistamine, how do you feel afterwards? You're ready to go to sleep, because you quiet down your excitatory neurotransmitter. So histamine is excitatory neurotransmitter. Okay. All right. So mast cells are good at producing histamine, but in the periphery, not in your central nervous system. Okay. All right. So let's take a look here into more details about this connective tissue. Right. So when you look here at the right thing of connective tissue, right, you're gonna find that you have loose and you're gonna have dense. So either it's like thrown there like loose stuff, or it's gonna be very organized and in parallel fibers with each other. Okay. And then when you look at specialized connective tissue, what you're gonna see in the specialized, you're gonna see cartilage, bone, so those are support, and you're gonna find blood. So support and transport. So those are specialized tissues that are used for keeping the body, supported, and also transport stuff. Right? So blood and lymph. The lymph derives from the blood in the first place. Support and transport for specialized. Right? And what you're going to find in the matrix, you're going to have all kinds of ground substance, right? In the matrix of all this connective tissue. So when you look at examples of bone, for example, you're going to have very solid ground substance, because you really have to cement those tissues together. Then you look at cartilage, it's, well, some cartilage is kind of hard, other cartilage is kind of soft. So you have three different types of cartilage, but it's still for structure. And then you're going to have this connective tissue proper that has the matrix that is more gel-like. So it's going from solid to not so solid to jello-like to liquid. So all different kinds of matrices that you're going to find in cartilage, I mean in connective tissue. So this is straight from your book, putting an organization of tissues and the kind of cells that you have and the kind of matrix that you have. And again, we're going to go through some more details on what you're going to find where and how to identify them. Okay. So proper connective tissue, you're going to have either loose or dense, and then we're going to look at subcategories of both loose and dense connective tissue. Then we're going to look at cartilage, and you're going to find the 3 different types of cartilage, and you're going to know what is the specialization for each one of them. Then when you look at bone, you're going to find 2 different types of bones. Again, what is the use and specialization for those types of bones. And lastly, we're going to look at blood and carrying function of the blood. Okay. All right, so let's look here at this mature type of connective tissue. You're going to have loose. So you look at this thing here and you say, it's kind of messy. The cells are not packed together. So this is definitely not epidermal type of tissue, right? And you look and you see fibers and you see mush stuff. The fibers are not packed together. So this is telling you this kind of tissue is loose and is a kind of connective tissue. Now, if you just look at it, you could say, oh, okay, it's a connective tissue proper. Okay. Now look at this other one here, and you see, oh, I see a lot of fibers, and they are very much parallel and packed together, very much packed together. So this is kind of dense connective tissue and is highly organized. So this could be either a tendon or a ligament. Okay. And then you look at this other one here and you say, oh, I see cells here and there. I see a lot of mush stuff in between, but I don't see fibers. Do you see fibers in there? Hopefully not. I just see gel-like stuff. So this is typical way of cartilage. This is how cartilage would look. Okay. And then you look at this other tissue here and you say, oh, these guys are really interesting. It looks like a straw. There is a hole in the middle. And the cells are organized in layers that look like a tree. Like when you cut the tree in the middle, it looks like these layers of a tree. So first thing you should think is this might be a structural type of tissue. And the cells are very much isolated. You have a lot of matrix in between the cells. This is bone tissue. Okay. All right. Then you look at this last one here. It's an easy one to identify, and well, it kind of looks like cartilage if you zoom into this. But when you look inside, when you look in more detail, you're gonna see white blood cells and red blood cells, and yeah, that's a giveaway. That's this blood tissue. Okay. Now looking here. Subcategories of loose connective tissue. Right. So 3 types of loose connective tissue. You're going to have areolar tissue, adipose tissue, and reticular connective tissue. Okay, so 3 types of loose connective tissue. This areolar tissue is basically all over your body. It's like a body suit, okay, all over your body. It is going to have mainly the 3 types of fibers. You're going to have collagen, elastin, and what is the 3rd type of fiber? Reticular fibers. Okay, so we're going to have all these 3 of them. And the fluid that holds it together is going to be a kind of gel-like, so it's not very tough. Okay, and you're going to have a lot of those proteoglycans that have negative charge, so you're going to have a lot of water that adheres to the connective tissue. Okay, again, the areolar connective tissue is going to look more like that bag of onions that you see in the supermarket. It's kind of like loose and is interlaced, and is mainly to hold things in place and to allow avenue for cells to communicate from one side to another. So the areolar connective tissue is very important for your immune system to be running from one side to another. Okay? And as we see, areolar connective tissue is right under the skin, right? So when you look at the skin, you're going to see that you have your epithelial tissue, then you're going to have more dense connective tissue right under it to keep it together, and right under the dense tissue, you're going to have this areolar tissue. Okay. Then you're going to see here this loose adipose tissue. Remember that this is also not very organized. And you should be looking at this and you say, well, what's the difference here between this and epithelial tissue? Because you also have cells that are packed together side by side. Epithelial tissue, the cells are connected to each other, right? You have tight junctions. In this case, you don't have tight junctions. The cells are not really stuck to each other very, very tightly. Remember, those cells can inflate or they can shrink, right? So it's not really packed like a sealed structure like you have in epithelial tissues, and also it's not covering the surface; it's under the surface, and it is vascularized. Actually, the adipose tissue has blood vessels, right? So another exception for adipose tissue. Okay, so no fibers in adipose tissue. We have mainly fat. There are no fibers there. Okay. Except if you have some types of diseases, but of course we're not going to get into that. Okay. What are the cells that are making up the adipose tissue? Those are called adipocytes. Okay. Well, here it says no ground substance, but you have a little bit of ground substance, just very, very little between the cells. It's more like extracellular interstitial fluid. Okay. And lastly, for this loose connective tissue, you have this reticular type of connective tissue, and the name is telling you you're going to find one type of fiber there. Guess what is the type of fiber that you're going to find there? Reticular. Yeah. Okay, didn't take much brain power. You're going to find reticular fiber. And you're going to find cells that are producing those reticular fibers. Okay? And also, these cells are going to be disorganized, like on the surface. You're not going to have a lot of ground substance, but you're going to have a lot of those reticular fibers. Okay? And you're going to see also where those tissues are showing up. So here, this is from your book, showing you this type of prototype of connective tissue. That is your areolar tissue. So you should look at this and you say, okay, what kind of fiber do I have? I have collagen fiber, so that's the thick one. I have some reticular fiber. You should be seeing some here. This one is saying is elastic fiber. Okay, reticular fiber is a thin one right here. Usually the reticular fiber is very crumpled up together, but this one is showing you is smooth right here. So it's showing you three types of fibers. And you see a lot of extracellular stuff. And if you see a lot of the white blood cells, you see the white blood cells here, immune cells here, then it's a telltale sign that this is areolar connective tissue, because the immune cells travel on those structures to get from one part to the other of the blood. And also, this areolar connective tissue is very much filled up with fluids, like I mentioned, is this gelatinous substance. And you can imagine that when you have inflammation, that's the tissue that gets inflamed. So let's put an example here, like let's say you're building out something. You're building a bird house, right? Bird something. So you have your hammer, and you're putting your hammer, precise work, and all of a sudden, you hammer your finger, and that does not feel good. And what is the first thing that happens? No, you didn't smash your finger. You just kind of hammer it a little bit. You know, yeah. I mean, if you smash it, it's going to start bleeding. But let's say you didn't break the skin. It swells, right? It gets like it hurts and it swells. This is the tissue that swells. Okay. The areolar tissue is the tissue that allows the liquid to accumulate there. So you can imagine, where is it in the body that you're going to have this type of tissue? Everywhere under your skin, right? Like in your head, you bump your head, don't you have some like swelling? Yeah. So it's like a body armor all over your body, you're going to have this type of mesh that can swell in case it gets some damage, right? So here, what is the use for this tissue? Well, it's very important for absorbing shock. Okay, and let me see here. All right, so I mentioned this areolar is a layer between the skin and underneath underlying muscle. Okay, so also adipose tissue is important for energy storage and for shock absorption, right? So this is all the functions of your loose connective tissue. Besides that, you have a type of adipose tissue that is called brown fat that is important for generating heat. Okay? You have two types of fats. You have the white fat and the brown fat. So you can imagine this is all loose connective tissue, important for shock absorption, important for traveling or communication of immune cells, and also important for insulation. So let's see here. This is a repeat of the slide I had before. Okay. So again, look here at the loose connective tissue, right? So now let's look here at the dense type of connective tissue proper. So this is when you're going to find fibers that are very much aligned in parallel to each other. So you're not going to find a lot of ground substance as you see with the loose connective tissue. You're still going to see ground substance, but it is going to be very little. Okay. So this type of arrangement you're going to find in tendons and ligaments. Now, basically, the tendons and the ligaments, they are made up of the same types of fibers, but they have different specific functions. Like tendons are going to connect muscle to bone. Then the ligaments are going to connect bone to bone. Okay? An important thing about this dense connective tissue is that it gives you strength in one direction. Okay? Is one directional type of strength. When you look at the loose connective tissue, it gives you all over multi-directional type of strength and cushion. All right, so again, looking here at your loose connective tissue, you have three subcategories. You have your areolar, your reticular, and your adipose. So here is straight from the book showing you the different types and where you're going to find them, right? So here's what I was talking about, the epithelial tissue, right? Right under the epithelial, you're going to have the lamina propria right here. Now, lamina propria is type of dense irregular connective tissue. Okay, so it's not loose. The lamina propria is dense because you want to have something to really hold on to your epithelia. You don't want the epithelia to just come loose, right? You want to hold it in place. So this lamina propria is more dense. But also you want this type of adhesion to be not only in one direction, you want it to be all over the place. So it's going to be dense and it's going to be distributed. It's going to be in all directions. Disorganized type of dense connective tissue. But then under the lamina propria, you're going to find this areolar connective tissue. And that's what you see over here. Now remember, areolar connective tissue is going to have a lot of mushy stuff and it's going to have a lot of white blood cells. Your immune system cells are going to be patrolling in the areolar connective tissue. And that makes sense because if you break the skin, and then the pathogens have the opportunity of invading your body, the first thing that they're going to encounter is this areolar connective tissue. So it makes sense to keep your immune system cells here in order to block the entrance of pathogens right close to the site where they had the opportunity to enter. Okay. So three main functions of areolar connective tissue is to support and bind, and then to protect against infection. So this is where your white blood cells come in. And at the same time, it's very much filled with liquid, right? You're gonna have you can store here nutrients and fluids that are going to diffuse to the epithelial tissue that is connected to it. All right, so that was your areolar. So here is an example of your reticular connective tissue, and you're going to have reticular fibers. Now, there are specific places that you're going to find these reticular fibers, like, for example, your spleen, liver, thymus gland, and kidney. So those are going to be important for the structure of the organ and also for filtering function of the organ. Okay. So here, the one main function of reticular tissue is to serve as a structural scaffold for the organ function. Okay. And here is an example of your adipose tissue that is also loose type of connective tissue. And what is the function of adipose tissue? To store cells and to serve as a cushion, right? So you have shock absorption. Besides that, you also have insulation type of function for adipose tissue. And where are you going to find adipose tissue? Most of us find it in places that we wouldn't want it to be, right? Like under the skin and the belly, and you can start looking around and you find your adipose tissue, like right under your skin, right? But besides subcutaneous adipose tissue, you also have it surrounding organs, right? You have it surrounding the heart, the kidneys, and especially this type of adipose tissue is important for cushioning of the organs. And you imagine like your heart, for example, right? Is always beating, hopefully, and you don't want it to be in friction with everything else in there. So you do have a layer of adipose tissue that cushions the heart. Okay. And yes, of course, in the breasts you find also adipose tissue. All right, so that was a loose connective tissue. Do you remember what the loose connective tissue is? Areolar tissue, reticular tissue, and fat. Don't forget the fat. Right. Then now here goes for the dense type of connective tissue, okay? Mainly for structural support and binding here. You're going to have regular, irregular, and elastic. So 3 types, subcategories of dense connective tissue. So here you go. For dense, you're going to have here regular, when you see all these fibers that are mainly on top of each other, okay? They're going to be in bundles, and you're going to see cells between those bundles. And actually, the dense regular connective tissue, when you compare it to the dense elastic connective tissue, they kind of look similar in their fibrous arrangements. Okay, so here, dense connective tissue is mainly going to find collagen fibers. You look at a dense irregular. Look at this thing here. It's fiber all over the place. Collagen fibers all over the place, but they are not in parallel. They're just like mesh of collagen fibers. And you look closely, you're not going to see a lot of this white dish stuff. So not a lot of matrix between those fibers. So the cells, the fibers look very densely packed and not organized. So you call that dense irregular connective tissue, mainly made of collagen fibers. Okay. And then you look here at this elastic type of tissues. The main fiber that you find here is elastic fiber, so that's easy to identify. Okay. What is the use of this? The tissue can expand, the tissue can contract back to the original shape, so expansion and contraction. And it's very important for protection of organs. They have to constantly be expanding and contracting and expanding and going back to the original shape, like your lungs, for example. Right? You inhale, you expand those fibers, and then you just relax. You don't have to really think about contracting the fibers, right? But if you just relax, the recoiling of those elastic fibers are going to bring your lungs to the original, to the primordial shape. Okay. So here again, with the dense connective tissue, you have two main types. Either they are very organized or they are messy. You don't call them messy, you call them irregular. They're regular or irregular. Then you look at a picture like this, these guys look very much regular, okay? And then you look at another picture like this, and these are not parallel fibers, although they kind of look the same here, but they should look a bit more disorganized. This looks more like regular connective tissue. Then irregular connective tissue, you're going to find a lot of twigs and turns. Okay, so how you identify them? Again, you're going to have fibers that are parallel to each other, and mainly you're going to have collagen fibers. You're not going to find fat in dense regular connective tissue. Okay, no fat there. Another thing that is typical of these tissues is that you're not going to find a lot of blood vessels. Okay, so when you look at tendons and ligaments, for example, when you have a tear on a tendon or a tear on a ligament, usually it doesn't heal very well. Kind of like cartilage tissue, right? Because you don't really have a lot of blood vessels and you don't have a lot of cells that are going to go there and repair the tissue. So when some tearing happens, what happens? Any athletes in the class? No? Yes, one person. So what happens? Oh, you are asleep. Ah, okay. What happens when you tear a ligament? What kind of treatment do you have to undergo? Huh? Sometimes physical therapy works, but for you to, if the tear is not too big, so you can make the muscles stronger around that in that tendon or ligament, so you can support the function. But if it's kind of bad, you need to go to surgery, because you need to surgically repair the tendon or the ligament. Because by itself, since it doesn't have a lot of blood vessels, you can wait forever and it's not going to heal. So you might as well just fix it surgically. So that's another thing. It doesn't have a lot of blood vessels. It cannot really be healing itself like on its own. Just like cartilage, damaged cartilage, it's not really going to heal very well. So here is a picture of somebody's knee. So here are ligaments. Ligaments join bone to bone. And tendons will join bone to muscle. Okay, and here is a picture of irregular, dense connective tissue proper. Right. So you look at the arrangement of these fibers, and you see they all randomly just thrown in there, very little mush or matrix. They're mainly collagen fibers, and what is the use of this thing is mainly to protect whatever is surrounding, but since it doesn't have that uniform parallel type of fiber arrangement that is important for one direction, this thing is important to protect in all types of directions. Okay, so it's really important to absorb shock or avoid type of injury in all types of directions. And of course, since it does not have that parallel fiber arrangement, is not as strong as dense regular connective tissue. Where are you going to find this kind of tissue? This is what you find in the lamina propria. Okay, so I don't have it written here, but you can write it there. This is the kind of tissue that is right under the skin and prevents the skin from falling apart. That's at your lamina propria, right under the areolar, right before the areolar tissue. Okay. All right, so here we see okay, more dense irregular type of connective tissue, and this is the type of layer that you see on top of the skeleton. So you have this fibrous layer that covers all over the skeleton. There's also dense irregular connective tissue besides the lamina propria. Then we get to the more specialized tissues, right? The specialized ones are bone and cartilage. So we know that the cells that make up cartilage, those are called the chondrocytes. Chondrocytes are more mature than your chondroblasts. Right? Chondroblasts are the baby cartilage cells. Chondrocytes are the mature cells. And you have three different types of cartilage. You're going to have one that is very tough. You call that fibrocartilage. You have another one that is not so tough. That is your hyaline cartilage. And then you want to have one that is really soft. So that's your elastic cartilage. So where are you going to find them? So elastic cartilage is the one that gives away very easily. So you look at your earlobe, and that is elastic cartilage. You can bend it easily. Nose, the tip of your nose is also elastic cartilage. Now, when you look at hyaline cartilage, that's more like the cartilage you find in the chicken bone between the joints. Right? Everybody eats chicken. You get the crunchy part on the top of the chicken, you know, the drumstick, right? And kind of crunchy. That's your hyaline cartilage. So when you go have dinner, if you have chicken tonight, you're going to look at it and you're going to say, oh, I see the hyaline cartilage. You try to crunch it and like, oh, it feels kind of crunchy. It's not too gooey. It's not too tough, right? So you remember to name it properly, right? And then you have this fibrocartilage. This is very much for shock absorbance and structural maintenance. Where you expect to find that? Lots of collagen fiber in this cartilage. Between your vertebra and your back, right? And other places that you do not want a lot of articulation and you need a lot of structure. Okay, in the vertebra you're going to find fibrocartilage. And what is it that cartilage looks like? So when you look at the hyaline cartilage, look at this. You have cells that are not touching each other. Those cells in cartilage tissue, they're kind of antisocial. They need their space. They stay in little lakes by themselves. Okay, so we see a lot of ground substance, and they kind of, you know, be a part of each other. Now in the hyaline cartilage, you're going to find some collagen fiber, okay, but not too much. So cells apart from each other, collagen fiber, but not too much. Then you look at here, fibrocartilage, then you still see cells away from each other. You see ground substance, but now you see a lot more fiber between those cells. Okay, in the matrix is going to see a lot more fiber. So this is very tough fibrocartilage. And then you look at this guy here, elastic cartilage, you're going to have a lot of elastic fibers. And you're going to see that, cells are still isolated away from each other. But it's just a different type of arrangement when you compare to the hyaline cartilage. Okay? So this is a more malleable type of cartilage. Okay. So let me see here, elastic cartilage. Yeah, just showing you how this laguna looks for the very flexible type of cartilage, and giving you the example here, earlobe. Okay. You see this cell that sits by itself, it sits in this little place called the lacuna. It's like a little lake. So it likes to stay away from the other cells. Okay, so it's basically like isolated in a little lake. Now this is really cool about hyaline cartilage. Okay, you see the amount of matrix is a lot more than what you see before with elastic cartilage. And also the cells, they tend to come in pairs. Okay, so hyaline cartilage actually it can expand. The cartilage itself can grow with time, but it grows very, very slowly. Okay. Well, actually, it depends on whether you're a child or an adult. Well, let's consider we are all adults. Right, we all past 18, 20 years old, so your long bones are not really growing much at this stage, right? But when you look at the cartilage, it keeps on growing. I mean, slowly, but it does grow. And where is it you find this type of cartilage, hyaline cartilage? joints, right? It's cushioning the bones, right? And you also have some hyaline cartilage right behind the elastic cartilage on the tip of your nose. You have hyaline cartilage right behind that. Okay? Is it possible that our noses grow as we get older? It actually does. Another day I'm looking in the mirror, I'm like, oh my goodness, I need some nose job. I think I'm getting old. It's a good excuse to get some, plastic kind of thing. But yeah, the cartilage will grow. Hopefully the elastic one doesn't grow as much, right? So it's like kind of, oh God. Some people are like really obsessed on what do you say, suppressing the growth of the type of cartilage. So yeah, cartilage can grow a little bit. Okay, so you see this kind of hyaline cartilage, you usually see cells in pairs. Pairs because the cell had divided, so they kind of stay close to each other. Okay, another place where you find hyaline cartilage is here in the ribs. Okay, so those are called costal cartilages. That's all hyaline cartilage. Okay. Now here's a tough fibrocartilage. Look at the amount of collagen that you have between these fibers here. Okay, lots and lots of collagen. And where you find it here, intervertebra, in the discs. And as you get older, that cartilage tends to get pressed, right? It kind of it depends if you practice a lot of sports or so, if you put a lot of pressure on it. Sometimes you get some little tears on this outer tough part of the cartilage, and then the inside of the disc has a bit of softer hyaline cartilage, not the fibrocartilage. And the softer core can like spill a little bit to the side, and then you get a herniated disc, and that hurts. I hope you guys don't have that problem yet, but it's common. It happens, right? So herniated discs, that hurts a lot. And also another thing, that cartilage is this very hydrated substance in the matrix, right? So if you press on it, it's going to get a bit dehydrated like throughout the day. So when you go to sleep and you're laying down, then the cartilage is going to get rehydrated. So you measure your height in the morning is usually a bit higher than your height at night, because those fibrocartilages compress a bit throughout the day. So at night, it's a bit more compressed. So you have to, rejuvenate your body by getting a good night's sleep, and then your cartilage will rehydrate, and you'll be, 100% in the next day, right? All right. So here's the other type of connective tissue: your blood. You're not going to have any fibers. Hello, obviously, right? No fibers in the blood. What kind of cells you're going to have? You're going to have white blood cells and red blood cells, and you're going to have fragments of cells like platelets. Okay? What is your ground substance in the blood? That's the plasma. It's right there. It's the whitish liquid. If you spin the blood down, you're going to get all the cells that go to one side, and the liquid part of it, that's your plasma without the cells. Okay, so that's your fluid, connective tissue, right? So it's going to transport things all over your body, including nutrients and defense cells, like your white blood cells, oxygen, carbon dioxide, no fibers there. Then lastly, you're going to have here your lymphatic system that is composed of several open-ended vessels that are meant to work like straws in capillary action. So when blood goes throughout your body, when it gets to the very, very fine capillaries, it will make the extracellular fluid, the interstitial fluid, and most of the blood will go from arteries to veins, but the blood that spills out in the interstitial fluid, it has to be reabsorbed by the open-ended capillary actions of your lymphatic system, of your lymphatic vessels. Right? So you're not going to find red blood cells here. Okay, the red blood cells do not come out of your capillaries. But you're going to find here the fluid that leaks out, and then is picked up by this system, and there are nodes all over this type of network, and those nodes are filled with very important white blood cells. So that is your adaptive immune system that sits on those lymphatic nodes. You have certain areas of concentration of lymphatic nodes, like around here and around your armpit and around your neck, okay? Because those are areas that you're going to screen for possible pathogens that could have invaded your system. Right? So here is how your lymphatic system looks like. And at the end, the lymphatic system dumps all the liquid back into the vena cava, superior, inferior, and it goes back to your heart, it goes back to your circulation. And then here we have the other type of tissue, your bone tissue. What kind of fibers you're going to have there? Lots of collagen fibers. Type 1, that's the tough one, right? Tough one is type 1 fiber. As you go up in the numbering of collagen fibers, they get softer and softer. So you have type 1, 2, 3, 4, 5, 6, 7, 8, I think up to 12. So the higher the number, the softer the collagen fiber. Type 1 is really, really strong. What kind of cells maintain bone tissue? Those are your osteocytes. What kind of cell starts to produce tissue? Those are your osteoblasts, right? And okay, ground substance is really tough. So you're talking about calcified type of ground substance. That's your cement, right? Okay, so here is a typical image of bone tissue. Again, if you compare it to cartilage tissue, those cells also like to be stuck in little lacuna. So they are in their little lakes, and they like to stay away from each other with a lot of stuff in between. The difference is that in cartilage tissue, this stuff is kind of gelatinous, and here this stuff is calcified. Okay, we talked about blood before and functions of blood. So here is just an organization of types of connective tissue and how to subcategorize them. So we looked at connective tissue proper. So you have loose and dense. When you look at dense, you're going to have three types. Oh, sorry, when you look at loose, you're going to have three types. Remember, areolar, adipose, and reticular. When you look at dense, proper, you're going to have also three types. You're going to have regular, so that's the one that's very much parallel. You're going to have irregular, that is the meshy type full of fibers, and you're going to have the elastic type. Okay. When you look at cartilage, it's also subdivided into three types, as we mentioned. The very tough one, the not so tough one, well, it's not in proper order here. So fibrocartilage, very tough. Not so tough is the hyaline cartilage. Softer one is going to be your elastic cartilage, then bone and blood. So if you see a picture like this on a test question, can you identify what it is? It is connective tissue, yay! Now, is it regular? No, it's irregular. Is it dense? No, you have a lot of stuff. So it's loose, irregular. What would you guess this is? Areolar connective tissue. That would be my guess. Okay. See, there we go, loose areolar connective tissue. Okay, so here description of what the thing that you are seeing. Okay. All right, so other types of tissues that you're going to find in the body, you're going to have muscle tissue, right? So finishing up on chapter 4 here. What kind of muscles? You have skeletal muscle, that's the muscle that you control. Voluntary is a similar interchangeable name for skeletal muscle. You have cardiac muscle, that kind of looks like a skeletal muscle, but you can't quite control, right? And I always have somebody who says, like, I can slow down my heart rate in my command. Yeah, but you don't really, control your heart as you control your hands, for example, right? So mainly involuntary. Okay. And then you have this smooth muscle that you absolutely cannot control. That muscle is on its own. It's really cool how this thing works, but it has a mind of its own. Okay. Okay, so here is organization of skeletal muscle. The muscle cells are really, really long, so you call them fibers. Okay. And when you look at the fibers, the muscle cells, you're going to see that they have a lot of nuclei. So these muscle cells don't have only one nuclei, they have several nuclei distributed along the cell. Okay, so multinucleated. That is your first indication that this thing is a muscle, is a skeletal muscle. Okay. Another thing you're going to see is these little shading areas, so striations. Okay, so you're going to see this intercalating dark and light pattern, and that's another telltale sign that this thing could be a muscle, a skeletal muscle cell. And of course, voluntary movement is the primary function of skeletal muscle cells. Okay. And then you compare here to your cardiac muscle. It kind of looks like your skeletal muscle, but the cardiac muscle is branched. Okay, skeletal muscle was all lined up like parallel to each other. This skeletal muscle, this cardiac muscle, it has branches that go from like one muscle fiber to another. And you tend to have only one nucleus per fiber. Okay, so skeletal muscle, several nuclei, cardiac muscle, only one nucleus, maybe two sometimes, per cell. Okay, so branched, only one. And of course, it is involuntary. Looks like skeletal muscle, but it is involuntary. And then you look at this guy, smooth muscle. It looks totally different. You have one nucleus per cell, but now you don't have those long fibers. You just have these cells that are close to each other, and it kind of looks like epithelial cells, but they're not. Okay, so they kind of look elongated like a football, and one cell, one nucleus per cell, and you don't see those striations like you see with skeletal and cardiac muscle. So no striated pattern here. Okay, where you're going to find those muscles mainly in guts, right? In digestive system, things have to move around on their own. So those are skeletal muscles. I mean, they're smooth muscles, involuntary. Then the last type of tissue that we have is your nervous tissue. And the function of the nervous tissue is to send information, either to a site or from a site to the central nervous system. So carry information back and forth, that is the function of your nervous system. And you're going to see some cells of the nervous system are highly specialized. You have this type of cell that everybody should recognize. It's a neuron, right? So you have one side, the body of the cell that has a nucleus, and you have all these types of dendrites. They're coming away from this center part of the cell. And then you have one of those protrusions that is longer than the others, and that's called the axon. Some neurons have two axons. And then at the end of the axons, you have more connections that goes to other the target cells. Could be other neurons or could be target organs. Okay, and mainly is for transport of information. You originate information at one site and you transport to the rest of the body, or you get sensory information and you decide what to do. So transmission of information, that is the main purpose of the nervous tissue. Okay, and I think this is the last slide. Yeah, just in time today. So do we have questions, comments?